Metabolomic Technologies, presented by its CEO, David Chang.
Thank you, Maria, and good morning, everyone. I'd like to talk to you today about how a simple urine test can be used to prevent colorectal cancer. So colorectal cancer is a very serious problem, and it's also a growing problem in the world today. It's the third most common form of cancer, and in Europe, it's actually the #1 form of cancer. And in 2012, there was 1.4 million new cases of colorectal cancer that year alone. And that's expected to double by 2035. And that's really a serious problem. So that's the bad news. The good news is that there's been a lot of research in the area of colorectal cancer. And there's a well-known intermediate known as an adenomatous polyp. So it's a growth in your colon that is known to develop into colorectal cancer. In fact, 95% of colorectal cancer comes from these polyps. And so in 2012, Ann Zeiber and her colleagues published an article in the New England Journal of Medicine. And in this study, they followed 3,000 patients. They all went for diagnostic colonoscopy. About 2,600 of them had these polyps removed. They followed these patients over a 20-year span, and they matched these patients to the National Death Registry in the United States. And in this study, what they found was those patients that had these polyps removed had a 50% reduction in colorectal cancer mortality compared to those of the average population. So this is very significant. And what's happening in the world right now is countries all around the world is already screening patients for colorectal cancer to have these polyps removed. The issue with the current screening programs is that they use a stool-based test to triage patients for colonoscopies. And the stool-based test has two problems. One is that it's focused on detecting cancer. So instead of looking for these polyps and have the polyps removed, they wait till they look for cancer, and then you go through cancer treatment. The other problem is a stool-based test. And unfortunately, the population just do not want to use and kind of work with their own stool. So sampling is very difficult, and compliance is very low for this type of test. So what we sought at the University of Alberta was we conducted research to really look for a urine-based test to detect these adenomatous polyps. So we used the emerging science of metabolomics and artificial intelligence to look for key biomarkers in urine that can be indicative of these adenomatous polyps. We've actually conducted 2 clinical trials. One was in Canada with 1,000 patients. The second one was in China with another 1,000 patients. We have 3 key peer-reviewed publications and 2 international patents. So our product, PolypDX, is a really simple urine test that you can do on an annual basis as you do your regular checkups with your doctors. You send these urine tests into the lab for analysis. If you're positive for polyps, then you get directed for a polypectomy, which is to have these polyps removed, and thereby preventing colorectal cancer. So where are we today? We're already on the market. We're selling in the US. I'm in talks with a company, a joint venture in China, as well as we're talking with provincial regulators in Canada, and we're looking to expand in Europe as well. Now, if we could actually screen the entire world population, we could be really saving over 300,000 lives per year, and that's very significant. Now, I want to leave the audience with this, is we've done this research and we've applied it to colorectal cancer. But the same technology can be applied to other cancers, like breast and prostate, or other diseases like Crohn's and colitis. So really, that is our vision, and that's our passion. Thank you very much.